Hi, I'm Laura Wood. I'm the Renal Cancer Research Coordinator at the Cleveland Clinic Taussig Cancer Center in Cleveland, Ohio. So my role as the clinical trial coordinator is really to be the navigator for the patient from the presentation of the clinical trial to informed consent, to appointment scheduling and the treatment plan. I'm also directly responsible as a point person for the patient and their caregivers for evaluating adverse events or side effects, for communicating side effects to the advanced practice provider and the oncologist, and coordinating multidisciplinary care as it's needed to help manage side effects. So kind of an all-around navigator, as I explained earlier.
Hi everyone, I'm Megan Price. I'm a nurse practitioner at Texas Oncology at the Baylor Sammons Cancer Center in Dallas, Texas. My role in regards to patients and clinical trials at my current practice is I'm a sub-investigator on many clinical trials right now. That does include, we thankfully have research nurses that can help us through the consenting process, but evaluating patients when they come in for treatment, documenting toxicity, walking them through the entire process of explaining even what a clinical trial is from the beginning, to just developing a rapport with the patient and carrying them through this process. I think we see this from diagnosis all the way through their treatment plan and managing side effects along with comforting caregivers. So we are able to see, as a nurse practitioner myself, the whole spectrum of patient care.
Hi, my name is Virginia Seery. I'm a nurse practitioner at Beth Israel Deaconess Medical Center in Boston, Massachusetts. I am a sub-investigator at my institution, so I see patients during clinic visits, perform their history and physical exam, facilitate treatment discussions, including potential clinical trial enrollment. So I'm reviewing the eligibility, whether the patient meets eligibility criteria. I review the consent form with the patient. If they decide to enroll and do go on the clinical trial, I assess the adverse events and review labs and make decisions about whether to continue or hold treatment in conjunction with a principal investigator. I also work very closely with the research nurses to identify and manage adverse events. And I am the key communication point with the patients and families.
I think the most important role that I play is that of coordinator, facilitator, and liaison. So I really put all three of those things in one bucket because that's the most important part of navigating clinical trials, treatment, and side effects. And so it's important that I'm able to liaison between all of the oncology team members. And that includes the infusion nurse and the rooming nurse so that the care is appropriate and we identify side effects early. So I think that is the most important role I play, is that point person.
So I think the most challenging component of being a nurse practitioner in oncology, in any field for that matter, is trying to ensure that you're giving the adequate amount of time and compassion for every single patient that comes in the door. I know we all go into this field with a passion and we try to share that with our patients, and with pages and everything else that can happen throughout the day, we have to try to refocus and make sure that we're doing right by the patient in the room. So I think we always feel a little guilty if we're coming out early in rooms and we're not able to spend adequate amount of time, but I think that's something that I always struggle with, is trying to just make sure that the patient feels I've answered all of their questions and spent adequate amount of time with each one of them.